for basic healthcare services. It allowed people to receive subsidies to buy health insurance. I was one of those people that wasn't buying health insurance until I got a subsidy from the Affordable Care Act. Just to give you an example, the kind of insurance plan that I bought on the New York State of Health Marketplace would have normally cost, like, the regular price was $500. And with my subsidy, I was paying just over $200 per month. So, someone working, just over part-time, that is a significant reduction in cost in terms of being able to afford healthcare. However, the problem was that there was no, it still kept the insurance, primarily it kept the insurance companies in charge of healthcare. And it did nothing to control the rising costs of healthcare because a lot of, millions of people still remained uninsured. In New York State, we have over 1 million uninsured. Nationally, there's still over 20 million uninsured. And a Harvard study a few years ago showed that for every 1 million uninsured, you would have 1,000 unnecessary deaths. So, we were still with 22 million uninsured after the passage of the Affordable Care Act, you can do the math. We're still seeing thousands of unnecessary deaths. Now, I would say that this is more of like a political, how do I say this? An ideological analysis of the Affordable Care Act, right? We already said that it kept insurance companies in charge of, as the middleman in healthcare. And another way to look at it is it's still a means-tested program. So basically, if you have a system set up where the poorest and working poor are benefiting from it, and then people that are hardworking, an income bracket up, still can't afford this basic necessity of life, which is healthcare, it's bound to create resentments, whether it's class resentment, racial resentment, right? So it's a perfect setup if you want to really, I think, for what we have now, which is like a really divided society, a lot of class and race resentment. And so a universal program that covers everyone, regardless of their income or where they work, is really what we should be organizing around, so that we're not demanding means-tested programs. So just like the poor or the almost poor are accessing a benefit, but rather we need to be organizing around universal human rights. This idea that regardless of where you work, how much money you have, your race, your immigration status, you have access to healthcare because it's a human right. And we have to also be really careful too about the language of citizenship that we use. I think really frequently progressives and people on the left still will use the language of citizenship to talk about access to things like healthcare or education. Like, we need to take care of all of our citizens and guarantee healthcare. No, we need to guarantee healthcare because it's a basic necessity of life, regardless of even your citizenship status or immigration status. But in terms of the Affordable Care Act and its failings, still maintain that structure that it's the poor and the working poor that get the free, like the low cost or benefit, and then folks that are working can't necessarily afford to pay for the healthcare that they need. In New York State, we have the United Way here published an economic analysis about the population in New York that is it's called. The phrase we use is called ALICE, which stands for Asset Limited, Income Constrained, Employed. Basically, the working poor. People that are working, but are one crisis away from bankruptcy. And so even with the passage of the Affordable Care Act, healthcare costs are still the leading cause of bankruptcy in this country. And most people that go bankrupt due to healthcare costs had health insurance. So I guess the point I'm making is just because you have insurance doesn't even mean that you can afford your health care.
Yeah, that's definitely one of the things that the Green Party also is fighting for is to raise that minimum wage because just like you said, so many people are the working poor. They may work 35 to 40 hours a week, but they are still just one crisis away from bankruptcy. Now, staying with the Affordable Care Act, obviously in the news lately, the Trump administration has been really adamant, and this is one of the things that the entire Republican program was running off of in the last election cycle, I should say, was the repeal of the Affordable Care Act. Now, with this whole thing being in the news lately, how does the fight to repeal the ACA affect the fight for single payer? Is it a good thing for single payer or is it a bad thing?
I would say it's up to us to decide whether it's a good thing or a bad thing, because we have to make sure that when we are in the streets fighting against the cuts to healthcare funding, whether it's the fight to protect the Medicaid expansion, the fight to protect subsidies, the fight to prevent insurance companies from discriminating because of pre-existing conditions. It's up to us to really bring the solution into that fight because a lot of basically a lot of I would say the national funded progressive groups that are allied with the Democratic Party aren't necessarily going to be including the call for universal health care as a human right in their organizing. So it's really up to all of us in the Green Party and in Green allied movements to bring that demand that healthcare is a human right into those organizing spaces. And there's a number of organizations and campaigns that are doing that. For example, Green Party activists in Maryland and Margaret Flowers, they've started the Health Over Profit for Everyone, which the acronym is HOPE campaign. Basically, it's a campaign to use the political moment where everyone's talking about healthcare to be demanding universal, improved and expanded Medicare for all nationally. So there's the Health Over Profit for Everyone campaign. There's also the Campaign for Guaranteed Healthcare. It's also a national campaign with resources. Also, lots of Greens involved in that national campaign. The organization Physicians for a National Health Program, lots of Green Party members also active in Physicians for a National Health Program. So basically, the current attempts to repeal the Affordable Care Act are actually creating spaces in which we can also demand universal health care. But now, if you hear what I recently heard that, for example, the Sanders bill there's been all this talk that Bernie Sanders is going to release a universal health care bill. But we have to be asking the question, if we're going to fight to stop the repeal of the Affordable Care Act, what are we fighting to replace it with? A lot of progressives or liberals will say, oh, we need a public option program. Let's organize for that. What I would say is no, our job as organizers is not to organize for what we think like those in power will give us. Our job as organizers is to change what is politically possible and demand what we want. It's because we can't expect, people to join us in the streets when we're talking about like half measures. But rather, we have to be calling for what people really want, which is guaranteed health care, guaranteed as a human right.
Absolutely. Now, I do want to understand what your personal view is. What is the single biggest obstacle that the fight for single payer and universal health care is that we are presently embattled with right now? What is the biggest obstacle?
I would say that it's the influence of the health insurance companies and the way that the insurance companies have established themselves as like this necessary entity within our healthcare system. It's also the way that the insurance companies are involved in funding political campaigns. So I would say the way the insurance companies really influence our political system, as well as the public consciousness over how our healthcare system should run. Often, when you hear people talking about healthcare, you often hear them say everyone should have health insurance, right? But that's not, we're just so conditioned to use that word insurance. And so, yeah, I mean, but then, I might also say that it's, the political establishment that stands in the way of universal health care. But ultimately, they also serve the interests of these for-profit insurance companies. And we've seen that in New York State, they are one of they're funding the opposition to our universal health care bill.
So would you say then that getting money out of politics is almost a sister battle to the fight for single payer healthcare?
I think, yeah, I would agree. I would definitely agree that getting money out of politics is a huge step. It's part of it is like, we have to be waging all of these battles at the same time. So like you said, it's a sister fight. But the question is like, we can't wait till we win that fight, right, to start organizing in support of universal healthcare. So we have to be engaged in all these struggles at the same time.
Okay, well, thank you for all of your insight. I just have one final question for you, Ursula. How can people who want to help the fight for single health care, how can they get involved?
Oh my God, there's so many ways to join the fight for universal health care. For example, in New York, the Green Party of New York is a member organization of the Campaign for New York Health. So if you visit gpny.org/healthcare, you'll connect with what Greens in New York are doing around this issue. I mentioned earlier that Margaret Flowers of the Green Party in Maryland started a national campaign, Health Over Profit for Everyone, the HOPE campaign, to advocate advocate and organize for the improved and expanded Medicare for All bill. So yeah, I mean, folks can check out what the Green Party in New York is doing, and you can also check out any of the national organizations that I mentioned. But I would say the thing that I think is most important in this work is that to remember that the public is on our side. Increasingly, opinion polls show that this is what people want. Healthcare. They want universal healthcare. They'll support Medicare for All if you put it on the table in front of them. The other thing is that even though we are seeing this wave of civic engagement, there's still a lot of people who are not joining us in the street, right? So while we're at an unprecedented moment of like the resistance, and you see like all these people with their pink hats out in the streets all the time, the numbers about participation and like voter turnout actually show the opposite, that while we still have we have larger numbers of people in the street, there are still a significant percentage of the population is still not engaged. So I would say that our winning this fight lies in, it's not just about being right, but it's about the degree to which we can get out and engage the non-activists to join us in this fight. And the only way to do that is to get out, to find them, to talk to them, and to listen to people's struggles in accessing this healthcare in the system. Because even though, someone might say, oh, I have health insurance, it's likely that somewhere along the way that they themselves or a loved one have faced obstacles to getting the care that they need. So I think the word of wisdom that I always have to people is being right is not enough. It's really up to us to get out and to organize the unorganized. And that's the way that we're going to win this fight.
Definitely. More people need to get active and stop complaining and just start doing. Absolutely. I just wanted to thank you so much, Ursula, for joining us here on the live stream, Green Stream here tonight. And more power to you. And hopefully, one of these days, we will absolutely get that universal health care passed. Because, just like you said several times throughout the course of this interview, it is a human right that everybody gets treated properly by our medical system. Is there anything you'd like to say before we close out?
Oh, there's so many things I would want to say. I just think that for the Green Party, this is a really important issue for us to be out organizing about. Single payer healthcare and universal healthcare are really part of our party's DNA. I would say this idea that we just all have economic human rights that need to be met, and so find one of those national campaigns, talk to local Greens in your area, and find out what it is that you're all going to do together that get you out talking to the people. And don't let anyone tell you that this is never going to happen, because it's up to us to change what's politically possible. And, I want to make sure that we, by the time I am old and gray, that I don't have to worry about out-of-pocket healthcare bills. So let's get out there and change what's politically possible.
Hopefully it won't take that long. Hopefully it will be sometime in the near future. Once again, thank you, Ursula Rosen, for joining us here on the Green Stream live stream. Once again, this is the Green Stream, where the revolution will be televised, where we're all about peace, ecology, democracy, and social justice. Ladies and gentlemen, I'm Theo Williams. Until next time, have a great night.